So the question is, can multiple medications be taken at the same time, and should they always be taken with water? And the other question is, what about taking them with juice, soya milk, wine, etc.?
Bless me, Father, for I have sinned. I have taken medication with a glass of wine. That's a good question, and you might ask, why the heck I didn't talk about drug interactions? Well, when I started learning about these kinds of things at age 20 or something, I certainly had it in my mind. You put metoprolol, what else? Ramipril, furosemide, a diuretic, digoxin. You put them all in your stomach at once. It's got to be a mess in there. But the reason I didn't get into it is it's really uncommon to have important stuff happen because of what goes into your stomach at that time. So you could take your 4 heart drugs in the morning and your cholesterol drug at bedtime, or you can take them all at once. It's really uncommon to have side effects related to taking those drugs prescribed, and you're taking them 3 or 4 or 5 of them. Now, unless it happens to you, because I certainly have people who say, oh yeah, I have to take those in the morning and those after breakfast because they kind of upset my stomach. That's just the way we are. As far as taking drugs with water, milk, juice, we can take them with anything. Now, there are drugs that get absorbed better on an empty stomach. And interestingly, narcotics are one of them, drugs that get absorbed better with a full stomach. And I think that's because, well, I don't think, I know that's because the liver is really busy dealing with fat and all sorts of stuff that has been associated with the eating. So it's distracted, and you get less of that first pass effect through the liver. So actually taking a narcotic with food is a little bit more effective than taking it on an empty stomach. It'll absorb a bit more slowly, but you get more drug in. So most times you can take your medication with anything. One little exception. In the last 15 years, we've learned a lot about the different enzymes that break down drugs in our liver. There's about, I'll just say there's 50 of them, of these enzymes. I cannot keep track of them. The only way I can keep track of these enzymes is having a chart in front of me and saying Prozac does this with this enzyme and Ramipril does this with this enzyme, that kind of thing. Now, these are only drugs that are importantly metabolized in the liver. But grapefruit juice can interfere with a couple of these enzymes. So when you look at that drug sheet, maybe 1 in 100 drugs or something will have an important effect from grapefruit juice. But you'll see on the drug sheet that you get, do not take this medication with grapefruit juice. What they actually mean is, don't drink any more grapefruit juice. Because you take this drug in the morning and you have grapefruit juice at lunch, it interferes with the drug. So grapefruit juice is the only exception there. Grape juice, totally different, fermented or not, but grape juice is fine.
About a grapefruit, like a grapefruit before
Exactly the same as
morning, and then you take the medication at night.
a problem.
A problem?
Yep. A problem, at least, that you should ask your pharmacist about. That's the best thing, because it's uncommon. Thank you.
So the next question is about a muscle relaxant, such as the Corbamol and Robaxet. Robaxet, I guess is the word. Is it good for helping with sleep?
Well, that's one of the side effects. So I'll tell you, I uncommonly, but I do prescribe methocarbamol, Robaxet, methocarbamol with acetaminophen. Robaxazole is methocarbamol, Robaxet is with acetaminophen. When I prescribe that, I almost always prescribe it only at bedtime, because I might even be deviously thinking, Well, he's having a lot of trouble sleeping with this back pain, and maybe it'll relax the muscles a bit, and I'll talk about it with the patient, and maybe it'll help sleep too. So the answer is yes, it can help sleep, and probably does not interfere with good quality sleep.
So the question is, you didn't mention anything about aspirin and how it can affect other drugs, or are there any drugs that you need to think about when taking aspirin? Maybe if someone's anticoagulated.
Oh,
if
yeah,
you want-
thank you.
If you're on Coumadin or warfarin,
Right.
if you're also on
Yeah.
aspirin, it certainly will increase your risk of bleeding.
Exactly,
Is there anything
yes.
else that you can think of?
If you are susceptible to, you have to remember how we prescribe aspirin nowadays, these 81 milligram tablets. We almost never take full-strength aspirin because it's too dangerous. It's one of the most dangerous drugs there is out there. I have seen 10 people die of aspirin poisoning, okay? A 17-year-old university student who has the bad flu and keeps taking aspirin because of the pain of muscles and skin related to the flu died from aspirin poisoning in our emergency room trying to get dialysis. That's why we don't have that's why we don't take aspirin for headaches and aspirin for backaches and that anymore. They're just too dangerous. 81 milligrams is one of the safest medications that's ever been prescribed. But if you're taking warfarin to prevent blood clotting from blood clots in the lung or from this abnormal heart rhythm, and you're trying to prevent strokes, aspirin can increase your risk of bleeding. Aspirin in some people, maybe those responders, get more easy bruising when they go skiing. That's one of the theories. So it's mostly related to bleeding risk. Those doses of aspirin do very little to these enzyme systems and do almost nothing to a kidney. 10, 20 times that dose can have a small effect on the kidney. So the 81 milligram aspirin is exceedingly safe.
So we have about 12 more questions, so we're going to have to be briefer in response. Okay.
If I can.
Otherwise, we will be here till midnight,
That's
as
right,
promised. So if someone's having a lot of pain, what would be safer to use for the body or harms the body less? Cortisone injections or painkillers?
Ooh.
It's a tough crowd.
I could cop out and say it depends. If it's a cortisone injection into a muscle that is hurting, I don't think there's enough value in that to justify taking it because it's only going to help you for a small number of days, and it's a toxic drug that will worsen your diabetes, okay? If you're skinny and have never had diabetes, then it's not going to do much negative at all. And then risk of increased appetite, weight gain, and those kinds of things. So a cortisone injection into the spinal canal can help back pain and decrease your taking of the narcotics for painkillers a great deal if it's helpful. That's a different thing. That's a once every 3 or 4 month thing. Taking painkillers, that is very, very difficult business, and I could talk for 3 hours on that, which I won't. But that's a big topic on its own. And you need to justify for yourself that it is helping more than it is harming. And sometimes it takes a spouse to talk to us about the harm, that you're dozy, you're not yourself, or you really are getting old, aren't you, or something like that. So taking painkillers is wonderful for short-term pain that will get better, like abdominal surgery. Wonderful drugs. Chronic back pain, chronic daily headache, it's hard for me to say, but that is not a good treatment for those pains. Do I prescribe them for those things? Yes, uncommonly, and I try real hard to give the best treatment as opposed to drug treatment. I'll leave it at that.
So if someone in the audience was wondering about the long-term use of Symbicort, is it harmful?
That's a tough one. That's one that's probably better to ask your pharmacist about. But the steroid in there can have a couple of side effects. One of them is that you actually absorb enough that it can cause a bit of weight gain. Not like you're taking prednisone by mouth and you turn into a balloon with squirrel cheeks, chipmunk cheeks. But you can get a bit of weight gain, a bit of increased appetite. You're not going to get psychosis, meaning being crazy, which can happen to a small number of people with prednisone. But you can get other subtle side effects that you might not notice, but your doctor might notice. For example, you get a blood test to find something out, and the doctor is confused because your white blood cell count is a little bit elevated. And there's no other reason. It might be the Symbicort, but it doesn't have any implications. And the biggest side effect you're likely to get is oral thrush from the steroid. But we absorb very little of that steroid.
Are there side effects to antacids? So there's Maalox, which as opposed to milk of magnesia. So the Maalox has aluminum hydroxide. Is there a side effect with that versus milk of magnesia, which has magnesium in it?
Okay. Actually, I think they're both magnesium-based, but Amphigel is aluminum-based, so it's still a good question. We don't think there are any side effects from the aluminum in Amphigel or what other aluminum hydroxide there might be out there. And notice I say we don't think. Very commonly used. They've been around for close to 100 years, so we're probably not going to see side effects from aluminum. The magnesium, we don't absorb a lot of the magnesium. One of the reasons we're taking this drug is to not absorb it. So we don't absorb much of that magnesium at all. And you would have to have no kidneys and no dialysis for that magnesium to have a negative effect. There's calcium in these, which can often be a good thing, of course. So the short answer is the only side effect I would come across with the magnesium hydroxide or magnesium-based antacids is loose stools. So milk of magnesia can be very helpful as an occasional laxative.
So the question is, what about osteoporosis drugs? What is the best thing people should be taking?
I don't think there is any best, other than the fact that if you could get a drug intravenously once a year, that's really nice, because then you are not going to get stomach side effects, you're not going to get esophagus side effects, swallowing problems, that kind of thing. There is such a drug. I don't think it's covered yet. Yeah. So, but it doesn't matter which one you get. What these drugs do is they get attracted to bone and they stay in bone for a very, very long time, like years. What we don't know is, can you take alendronate for 1 year and never take it again for the rest of your life and still get the benefits? We actually don't know the answer to that. So we continue to give the drug. So it really doesn't matter. I think they are pretty well equally effective. More often they're prescribed different, you prescribe different ones because of side effects. So.
Have you found any natural products that have been effective for a number of chronic, common conditions as opposed to pharmacologic medications?
The biggest one I can think of is aspirin from the willow bark. And as an aside, we did see one person who drank too much willow bark tea and had dangerous aspirin poisoning for about 2 days. So that's one. A lot of you have to the history of pharmacology is another lecture, but they all used to be natural, and then we learned how to make them to be purer. Then we learned how to make them to fit with certain things, and then we learned how to examine a receptor and design a drug that only fits in that receptor. That's the history of pharmacology in a nutshell. Any others? Lanolin would be one. I think that's a natural product. which is really good for skin, good old intensive care lotion. But the reason I'm not a fan of natural things, I've tried not to be too obvious about that bias that I have. The reason I'm not a fan of them is they've never been tested. People take things because they're natural, because they think they're safer and better, and they have never had a single test done in a human being. To me, that's dangerous pharmacology, okay? So I would much rather take a drug that has been exquisitely and expensively evaluated, and sometimes fraudulently evaluated. Let's be honest. The drug companies have been known to have no scruples, and it has cost them millions and millions on occasion. But I much prefer pharmaceutical drugs that I know are pure and have been tested in lots of mammals like me. So,
Does the absorption lipid versus water-soluble drugs have to do with the cell membrane permeability?
yeah, very good question. And the simple answer is yes. A lipid-soluble drug, well, Valium's a good example. You take Valium by mouth, it goes into the stomach, you can usually feel it fairly quickly, well within 10 minutes, because it goes through those lipid membranes. Every single membrane of cell in our body is made up of well-structured fats. So fats are important. Don't avoid fats. But yes, that's what lipid-soluble drugs do. They go through fat really nicely.
What is PGX used for? I'm not sure. I don't know.
Ooh.
Maybe I didn't spell it correctly. Or I'm not reading it correctly.
I don't know.
The compound appetite, I think.
What is it?
I read it once. The compound appetite, do they have less appetite? Or
Ah,
Oh,
something
okay,
like that, I think.
okay.
PG something.
Okay.
okay.
And does it react with hydrochlorothiazide is the question.
Okay.
Something like that.
Okay, I have to say I don't know, but I can tell you that the history of anorexiant drugs, drugs that cause that symptom of anorexia, meaning loss of appetite, that the history of that kind of drug is fraught with difficulties and heart problems. Even drugs that I prescribed 10 and 20 years ago that I thought were good. So I guess on that one I have to say I don't know, but the pharmaceutical drugs tell me that it's probably risky business, or it doesn't work. But
What would you think is the best medication for anxiety and panic attacks? So we're wondering about Rivotril or Paxil.
Okay.
And the follow-up is, do they cause dependency or possibly addiction? And is there like a time course to stay on these medications?
oh boy, that's a cluster of
Yeah.
beautiful questions. First of all, the best treatment for panic or anxiety or both?
Anxiety or panic.
Okay. The best treatment for that is an intensive cognitive behavioral therapy program that you can't afford. And that's what works better than anything else, and nothing else comes close to it. Okay? So again, the best drug is no drug, but how many people can afford $150 a week for cognitive behavioral therapy? Very few. But to answer the other questions, I would try the Paxil and be aware of its side effects of possible weight gain, sexual dysfunction, those kinds of things. Be aware of that. Try the drug and ask yourself, geez, do I feel calmer? Am I having less panic in the last week? Is my sexual function okay? Or some people, sexual function isn't important. But that is a very common side effect. With a high enough dose, it's a universal side effect of Paxil, Prozac, Zoloft, that cluster of new drugs. Clonazepam or Rivotril is undoubtedly the best benzodiazepine, like Valium, for that symptom. But you need to remember you're only treating the symptoms. They do make you feel better. You don't want them to make you feel good. In other words, I'm taking that because I like it, it feels good. You want to take it because it makes that symptom better. The difficulty is tolerance, dependence, and withdrawal. So you get tolerant to 0.5 milligrams 3 times a day after a couple of months, and you go to 1 milligram 3 times a day for a couple of months, then 2 milligrams 3 times a day. Before you know it, you're stumbling and having trouble walking. Unless it doesn't happen, of course. Those are the two classes of drugs, that class of antidepressant and the clonazepam. The thing about clonazepam, though, is the first time you take it, you think your doctor is just a wonderful human being because you definitely feel better. It's just like what's the commonest drug people abuse with panic attack? Alcohol. It's a really nice sedative that works really quickly. So people will try to reproduce that feeling and easily become addicted to alcohol. Addiction to clonazepam, if you're taking it because you like it and you're taking it because of side effects that make you function poorly, I would call that addiction. And if you stop it abruptly, you will get withdrawal symptoms that can be dangerous.
I think we only have time for one more question, and I'm sorry if I didn't ask your question, but Dr. Kennedy will be around for a few more minutes afterwards,
Sure.
so you could ask him.
Thank you.
I'm not sure if I'm going to say this correctly either because I wasn't sure what the letter was, but is there any contraindication of long-term use of protozoan or
Proctus? P-R-O-C-T? Oh, okay. Yes, because it's a steroid and it gets absorbed. This is a medication that you would give rectally for hemorrhoids. And I've used the drug a long time ago. Fortunately, not a nice symptom. And can be really helpful. I think if you use it for 10 days and then 6 months later you use it for another 10 days, the chances of something important is really, really small. If you use that every day of the year, you are going to be absorbing some of that steroid. And you may get some fragile skin. You may get increased appetite. You may get fluid retention, that kind of thing. So not something to use every day of the year because there is a steroid there. And those membranes around the rectum absorb drugs fairly nicely, unfortunately. Good bowel habits, which are very difficult. Yeah, very difficult in our society today. Drink lots of water, have lots of fiber, decrease carbohydrate intake. You simply do not see bowel cancer and diverticulosis and hemorrhoids in Central Africa. Doesn't happen. It's all diet related.
So I'd like to thank Dr. Kennedy for giving us a great talk and answering the questions. And if you have feedback to fill out your evaluation, we appreciate your comments. And if you have other topics that you would like us to try to find speakers for, we are very open to that as well. And we welcome you to come back next month. I think it'll be a very interesting talk with Dr. Chakrabarty and one of the nurse educators in the atrial fibrillation clinic. So thank you, Dr. Kennedy.
Thank you.